Hello, everyone that's joining us.
Like we lost Tina, so we'll have her come back in. All right, and I just messaged Tina to let her know that we're going to wait for her to facilitate. She's trying to get back on as we speak. She was talking about some Wi-Fi issues, so um, we're going to keep you here, and she'll get right back on. I like the joke that we are OT, not IT, and if something's going to happen, we are going to learn to continue to build the plane as we fly it. We continue to do that every day when we're enjoying technology. So that's what we're trying to teach our clients to do, right? To keep going no matter what the circumstances are. So she's furiously texting me, going, "Oh my Lord, tell everybody I'm coming," and she's going to restart her computer. So if you could hang tight, that would be great. Hopefully, everybody is surviving the time change pretty well. Um, I know that is not the funnest thing for me to see the sun go down at 4:30 in the afternoon, but um, hopefully everybody is making an adjustment with that. I have some students from California and out west, and I know that this is going to be weird to have this time change occur. So hopefully you all are doing okay with this. All right. So we'll give her another minute or two as I continue to communicate with her. And if we need to, we will begin on our own a little bit. We'll just give her another minute because it's not her fault. And certainly, if anyone has any questions, they can put it in the chat. Maura and I can monitor that as well. So we're sure to answer any of your questions if our presentation does not do that for you. All right. Let me see if I can get the presentation at least up. All right. And I am not sure if I have sharing. Yeah, I do not have sharing capabilities thus far. So that's fun. But um, all right. Well, why don't we get started a little bit so that your time certainly is valuable? Are you okay with that, Maura? Oh, wait, look at that. Right when I was,
Oh,
hey,
I am so sorry. There's something wrong with my computer, and IT tried several times today to fix it. So I am doing my, I am so,
no, we're ready for you. If you want to put that PowerPoint on, we are.
absolutely. So I do apologize, everyone. I'm going to start right now.
I explained to our team listening in that we are OT, not IT, so we will continue to problem solve in any
Right,
situation.
can everybody see my screen? Great. Thank you, everybody. And thank you for your time once again. My name is Tina Hills. I'm an admission counselor at the Massachusetts College of Pharmacy and Health Sciences. Some of you I hopefully have spoken with or will speak with as you begin your OT journey, or are hopefully one of our students that has already been accepted into the program and you're weighing your options. I'd like to introduce Professor Dowling with us this evening and one of our OT students, Maura. So thank you both. Professor Dowling, did you want to give a brief introduction of yourself and
I
then
would
more of the same?
I would love to. So my name is Michelle Dowling. I've been teaching at MCPHS for 7 years now. I started out as an adjunct and I was still a clinician, and now I'm a full-time faculty member on the Worcester campus for the Occupational Therapy MSOT program. And I teach evidence-based practice, adult rehab, vision and cognition, and environments and technology. So we learn how to manage technology and use it to our advantage when caring for our friends with functional loss.
Great. Laura?
Hi, everyone. My name is Maura. I'm a current second year here at MCPHS on the Manchester campus, and I completed my undergrad with MCPHS, and I just received my bachelor's of health psychology this past May.
Great. So this is being recorded and we will be sending out the link later this week. So just wanted to let everyone know that. We're excited to share our offerings, the School of Occupational Therapy, and where you're going to hear more about the program, how to apply, and answer any questions you might have at the end of the session. So we're going to get started. So wonderful that you're deciding to pursue a healthcare field. It's a amazing profession to go into, and occupational therapy especially is in high demand. With that aging population, jobs are going to, for OT are going to be even more demand. They're actually ranked in the top 4 in healthcare right now, which was ranked by the U.S. News World Report. And it means that our students are finding jobs after graduation. Some are getting offers while they're still in school at some of their clinical rotations. So that's really in their field workplace, which is huge. And that demand is just going to continue to increase over the next several years. As you can see, through 2033, there's an 11% increase. Now, we realize that going back to school is an investment in time, but the opportunity with your job outlook and this investment in yourself, and having an education with MCPHS is something that will return dividends over the years to come. So we want to share a little bit about MCPHS for those that don't know. We are a healthcare specific university, and I feel like that is a differentiator for us because you are going to be surrounded with like-minded professionals seeking, students, and then your faculty, and most of them are practicing clinicians. And so you are going to be at the forefront of trends and knowing the latest. MCPHS has over 100 different programs. and we just celebrated our 200th anniversary. So we've been around for a minute. There are 7,000 students right now that are enrolled at MCPHS on one of our 3 campuses, or we have numerous online programs as well. So we have, because of our longevity and our reputation in healthcare, we have a lot of clinical sites and renown, and throughout really the country. So you've got leading, Catholic Medical Center, St. Vincent Hospital, Reliant Medical, Newton Wellesley, UMass Memorial, and that's just to name a few. Our faculty are active providers, they're up to date, they're bringing expertise back to the classroom with them. And then you're again around with students that are working towards a healthcare profession, and that's not just an OT. We'll talk about that in a minute, but you're going to be around other students in healthcare that are pursuing healthcare professional degrees that you'll be able to collaborate with. So before we dive into the details of the OT program, we want to talk a little bit about the services and opportunities that are available to you as a student. So we're very hands-on, not just in our labs and classroom, but with the services that we provide students. We have something called interprofessional education, or IPE. And I think this is such a unique benefit that we offer for students. So as in the healthcare field, it's about collaboration and teamwork and working across professions for students. And we do that as a student, you'll be participating in that. You might be working with pharmacy or optometrist or PA students or nursing, and those you're going to be interacting with on a regular semester basis through our IPE. So I thought Maura could share a little bit about her IPE experience and what that means.
Of course. So I participated in 3 IPE events. So as an OT student, you'll be doing 3. The first one is just to gain a foundation of what others do, and also educating, which is a huge part of OT, educating others what OT actually is. My favorite thing to tell people is the PA students have no clue what occupational therapy is. Every single IPE event, I was always educating them, telling them what OT is, so they know that they can refer their patients to us if they need to be referred out. The second one was a book club, so that one was really great too. Everyone read the same book, and we met up and we talked about that book. Then the last one was about opioids, and how everyone can play a role, even OT. Like, I learned a lot with that one because I had no clue what OTs can do with the opioid epidemic. So just learning and educating people of the other cohorts here on campus is really nice.
Yeah, it is. It's a wonderful opportunity. So, if you have a patient that has low vision, for example, you might be working with an optometrist, so you'll have, be able to interact, like you mentioned, with PA or physical therapist or anything like that. So it's a great opportunity for you to understand what other professions do, but also networking opportunities and camaraderie, and getting to, our campuses are smaller and students get to know each other. So that's great. So, Maura, did you want to also talk about some of the student services that we have?
So sorry, we have a
No,
lot
go ahead.
on campus. We have counseling services, we have academic coaches, faculty advisors. So that is when an OT professor is going to be one of your advisors, and you just meet if you have any concerns, if you want to go over any courses, any personal things that are going on in your life that may be affecting your academic life. We also have peer tutoring. So the second years will be tutoring the first years, or even sometimes people that are doing very well in their courses, they can help as well. We have student life, so we have clubs and organizations. We have SOTA and COTAD here for OT. Then we also have other groups as well that you can participate in. I know here on the Manchester campus, we have the outing club. Since we are in Manchester, we're close to the lakes, we're close to the beach, we're close to Boston. We have so many places that we can go, and we take full advantage of that here. We also have career services, which is an awesome thing to use once you are nearing your end here of the OT program, they can help you with resume, mock interviews, cover letters, helping you find a job, all of those things. It's just great things that the school offers and things that'll help you in your career or even in your personal life that you need help with.
Yeah. Wonderful, thank you. And I think it is great. There's a lot of students that are involved. I know we're primarily in graduate programs, but you'd be surprised. So the outing club did a kayaking event and brought ice cream onto the campus, our SGA. So there's a lot of opportunities while you're all working hard and studying, but to have that community feeling on the Worcester campus and the Manchester campus. So it is wonderful. So as we kind of segue into that, we have two campuses, and we're going to talk about our Manchester campus first. Now, Manchester is located in southern New Hampshire, about an hour north of Boston. It's in right downtown Manchester. And the campus itself is a wonderful community. It is a kind of a small, tight-knit with students and faculty. Everyone kind of gets to know each other. But the city itself is kind of like the campus, small and quaint. There's restaurants, there's things to do. There's definitely things to do for students, but there's, within a short walk and drive from campus, you have access to parks and museums and concert venues. But it's centrally located to the mountains. So if you hike and you're active, we're an hour, it's an hour to the seacoast, and again, to quick ride to Boston as well. The campus was established in 2002, and there's about 15 actually colleges and universities in the Manchester area. So it is a bustling area with students. There's about 400 students on the campus altogether, and you are going to again get to know your classmates and your faculty and students in other programs. And there's also so many clinical affiliations in the area. So you are, again, the New England area is known for having some of the best healthcare in the country. So not to be outdone is our Worcester campus. It's about 45 to 50 minutes from Boston. And it's the second largest city in New England, actually. And you're going to find healthcare right there as well. We're right next to St. Vincent's Hospital, right down the street from UMass Memorial. Field work sites are within a 10-mile radius. And so it is a hub of healthcare in Worcester for sure. NPR actually deemed Worcester the new IT town back in 2018, and it's become a hub of innovation and center for higher education. There's 8 different colleges and universities in the area, lots of restaurants, places to go, sports arenas, and you're not too far from the mountains or the coast either from Worcester, so it's also very convenient. There's 9 programs actually on the Worcester campus, and there's 4 programs on the Manchester campus. So we're really proud of kind of how much we've grown our programs and are always updating our labs. They've invested a lot of money in the Worcester campus in terms of we have housing on Worcester, which we'll talk about in a minute, state-of-the-art laboratories on both campuses. On Worcester specifically, there's actually an active dental hygiene clinic, there's an optometry clinic, and we have a physical therapy and acupuncture centers. So there's some hands-on that we benefit from the community, and it's great hands-on experience for our students. So all programs are year-round. And what I do want to say is we'll get into is that both of the programs on occupational therapy in Worcester and Manchester are exactly the same. So now, to start about our occupational therapy program, it starts in the fall. It's an accelerated 24-month program. And what does that mean? That means that you're going 7 days a week. No, I'm kidding. It is a program that you start in the fall and you go fall, spring, summer, and then fall, spring, summer. You have do have some time off in between. So it's about 2 weeks or so, and Maura, maybe you can elaborate on how your breaks work in between that. And you're in the beginning of your first and second, you're really doing observational level 1 field work, and Professor Dallin will talk a little bit about more of that. And then by your last 2 semesters, you're doing field work full-time. Occupational therapy is rooted in mental health, so that's woven throughout our curriculum. And you're hands-on that kind of from the final 2 field work semesters, so it's great. And you don't have to be on campus. So one of the things I just say to anyone that I'm talking to is that if you live a little bit farther from campus and your last 2, you're looking to be closer to home to do your field work, that's something you can work out with the coordinator as long as we have an affiliation. We do really try to accommodate that. You will do an adult rotation and a pediatric rotation. So you're exposed kind of to both as well as different modalities. So there's about 45 students in for both cohorts. All right, Maura, do you want to talk about the typical kind of life as an OT student right now?
Sure. So I'm in my second year, so it's a little bit different than what the first years are going through. As a first year, you start at 9 in the morning, and depending on classes. So 3 days out of the week, you're there until 12:50. You have 40-minute breaks in between each class. Then 2 days of the week, you're there until 12:20 because you just have 2 classes that day, and they tend to be a little bit longer. And you still have the 40-minute breaks between that. For your first 3 semesters, you are there starting at 9 a.m. and you're out around 12:20, 12:50, just depending, or if you have lab a little bit later, just depends when you have that. As a second year, you do start in the afternoon, so that's going to be your second fall semester. You're going to start at 1:30 and you'll get out around 4:20, and you have 10-minute breaks in between each class. You also have labs, as I mentioned, and then you have field work. So you have your first field work starting in your second semester, which is your mental health groups that you're doing. So you'll be paired with a few of your classmates, and you're going to be going off to sites, and you'll have a field work coordinator, a faculty member from the school, and you'll be running groups, which is really, it was honestly one of my favorite level 1 field work so far. And then your summer semester, you're going to be starting your adult. And then your fall semester, your second year, you're going to be doing your level 1 peds. And then after that, you're going off onto your level 2s. So I'm getting ready to do that. But yeah, that's what the schedule looks like.
Yeah. And it's really designed to, and I'll let Professor Bowling chime in too, is so if you have your classes Monday through Thursday, you know, one of the semesters and Friday off, it allows for either field work, studying, study groups, part-time jobs. Many students do work while they're in the program, and then it does switch. Like Maura said, right now she's in afternoons, but that first year you could be doing, you know, either Monday through Thursday or Tuesday through Friday classes, and then you'll have those labs in the afternoon. So it is kind of designed for that flexibility as well. Now, I'd like to turn it over to Professor Dowling and share what makes this program so fabulous, and it is absolutely fabulous.
It's definitely a fabulous program. And I do not just say that because I'm part of the MCPHS family. I've worked in other academic settings and certainly went through academia myself. So here at MCPHS, there's several themes that are tied throughout the curriculum, which makes this program unique from several others. First, mental health and wellness. So you may not have known it, but OT originally began in mental health. And we moved away from that for some time and towards other medical models. But recently, OT is passionate about being the profession that puts a stronger focus back on mental health and wellness. So as a newer program, we are able to incorporate a much stronger focus on this area. And as you move through the curriculum, you will notice the emphasis on mental health and well-being, and it's woven throughout. The second important thing about our program is research and scholarship. So we feel very strongly about evidence-based practice. I teach evidence-based practice. I get the ball rolling, and you have threads of research throughout your curriculum. And for this reason, the research courses are offered every semester during the didactic portion of the program, which is what Maura's finishing up right now. And it gives students opportunities to learn how to incorporate research into their level 2 fieldworks, regardless of the setting. Outside of the classroom, we host the NHOTA conference. I just got back from speaking at that. We had 50% of the participants were students. So that was a great participation for hearing the evidence that's out there in OT. And every year, the second year Manchester OT students have been able to present posters at this conference. Additionally, this past year, our second years from Worcester presented their research at the MAOT State Conference. That was the week before. And there are really great events and opportunities for students to learn about evidence-based practice and network with other curriculum and other clinicians. Maura, do you want to talk further about that and your experience?
Sure. So the first semester, you're in evidence-based practices, which Professor Dowling teaches, as she mentioned. And it was such a great intro. In undergrad, I was a health psych major, so it was a lot of research. So having that background really helped, but it's not something that you you need it, but they also help you as well if you aren't understanding topics. It was a really cool class because it also tied into your level 1 fieldwork of mental health. You kind of weave in between both of those. The second semester was really awesome. I really enjoyed the summer semester because we did mindfulness, and that was what the posters were about. So we just made those this semester. And it was just showing about stress. Like you did all of these assessments to your classmates, to your peers, and you would see what their scores were, and you would write a paper on it. And then this semester, well, my semester, we made a poster on it. So it was just really cool to see what those outcomes were for grad students.
Excellent, thank you. As she was talking, I was thinking another great component of our school at MCPHS with the OT program is that we use the model of clinic as classroom and classroom as clinic. So you're not only learning the content, but you're practicing and applying what you've learned the entire time. So we have really fantastic classroom spaces that are designed to mirror OT clinics. Our adult labs, I teach adult rehab, are equipped with a full kitchen, bathrooms, various adaptive equipment, and we also have full pediatric labs with lots of sensory integration equipment that you would typically see in a sensory gym with swings and toys and all sorts of fun tools to learn about. We also incorporate technology into our courses, such as virtual reality and the BINS. I have a client who comes in and talks about his BINS unit, and my students can actually see the BINS function in real time. And classes are very engaging and interactive overall. The time is filled with small and large group activities and discussions. I do Kahoot games. The professors love to do guest lectures. So it's very rare that the professor would be the only thing that you'll be hearing about throughout that whole duration of the class, and the semester is very dynamic. Another and final important thought is that the faculties are leaders. So the faculties are involved in research. I have a research project going on right now. Our director is conducting research on the use of virtual reality in rehab, and also researches the effects of mindfulness. Some of our faculty are working with the optometrist to conduct research about low vision populations and vision therapy. And one of our faculty members is working with a local university to develop a suicide prevention program. So I enjoy doing a lot of the vision stuff. And I know Dr. Sylvia is doing a lot with the local children's hospital to conduct research on peds with chronic pain management. So our faculty are very active on the national OT conference levels, like I told you. We've attended Kansas City. We're looking at Philadelphia. It is very important that we get out there and learn what everyone else is doing in research and bring that all back to our students. One of our faculty members is the president of NHOTA, Dr. Danielle Amera, and she's very involved with state policy and legislation. And I am also the representative for the American Occupational Therapy Association for the state of New Hampshire. So as you can see, we are all very dedicated in advocacy and wellness to the communities we serve. Speaking of community connections, There's fieldwork prep. So what also makes our program unique is our community connections that we have. So we have great relationships with our surrounding communities, and this means that the students have lots of opportunities for hands-on learning. We have sites in Manchester and Worcester that work with us regularly, especially for the level 1 fieldwork rotations. And lastly, those community connections really help our students become prepared for their level 2 fieldwork rotations. So level 1 fieldwork rotations correspond to the focus of each of the semesters so that students are learning the skills in the classroom, and then they're taking these opportunities that they've learned and observe in the practice settings that they are on their level 1s. And then we'll move to slide 9. Okay, and so if I may continue, I'd like to give you an overview of the curriculum. So we try to have a focus in each semester during the didactic portion of the program. The first semester, very mental health focused. And again, this will stay throughout the threads of the program. Semester 2 focuses mainly on physical disabilities and rehabilitation, where you're going to learn about adaptive equipment and assistive devices and how to conduct evaluations and plan interventions for individuals with sensory motor impairments. Semester 3 pulls in the neuroscience, adult rehab, upper extremity injuries, including stroke and spinal cord injuries. And in both campuses, we bring in survivors of spinal cord injury to speak to us. In the 4th semester, it's when you'll take your pediatric courses, and you'll also have some specialty courses such as cognition and vision that I teach, and program development. In the 5th and 6th semester, these are your level 2 fieldwork rotations. So Maura will be heading out on those. And I do want to point out that during your fieldwork, you will also be taking some online classwork, which is really going to gear you towards helping you transition out of the student role and into the professional role. So these courses focus on things like organizing the documentation needed to register for the boards, obtaining licensure, building your resume, joining and supporting OT organizations. You'll also notice level 1 and level 2 field work, which are indicated by those stars. The purpose of level 1 fieldwork is to really introduce you to different practice settings, and they occur in conjunction with your didactic courses. So it might be a full 2-week experience or a once-a-week experience throughout the whole 15-week semester. Level 1 fieldwork rotations don't have a ton of hands-on work with clients. That's really where you'll see that in level 2, but you'll be maybe leading some groups or assisting your supervisor during their sessions. So level 2, you have 12-week experiences working full-time following the schedule of your supervisor. And that may be depending on the setting that you're at. So you might do 4 10-hour days or 5 8-hour days. This might also include weekends or evenings if that's what your supervisor and the clinic have to offer for the populations they serve. You'll have one rotation, which will be in pediatrics, and the other will be working with an adult within the adult setting. This is where you'll find across various services like the schools, which is mandated by a code. So anything that you are doing on field work, it's because the schools are mandated by a code, our accrediting body, to have you do for your level 2s. So we do have flexibility in terms of the locations of your level 2 settings. Many students stay in New England, and many are going to other locations further away. Several of our students have been to California, Texas, Florida, because they want to be closer to family and friends. We have fieldwork coordinators that will help you with your process, but be sure where you choose to go that you have some routes to help keep you grounded. And I'll let Maura talk to you a little bit about the didactic experience.
Yes, so the didactic has been a great part or an amazing part of this program because I've learned so much. The first semester, you're really learning that foundation of occupational therapy. And I really liked the mental health. Honestly, I liked all of them because it just gave me such a knowledge of what OT was and grew upon it. My favorite class so far probably has to be the motor class. I did not think I was gonna like it at all. It did not seem to pique my interest, but I really liked it. I learned so much. And also, I want to work in peds, so the pediatric class that we're in right now is very cool because we're learning so many assessments, diagnoses that we can see, stuff like that. And just a little bit to talk about my level 1 experiences. One thing I love to mention is for my adult, I was in an acute care at Leahy Burlington in Massachusetts. And one thing that really sticks out to me is one day we were learning about amputations. The next day I saw an amputation in the hospital, or not an actual like amputation, but I saw an amputee. He was a below the knee, and he on the other leg also had no toes. So it was really cool to see how an OT would adapt around that because they did not know that before going into the room. And just seeing them adapt and modify what they needed to do for that session was really cool. And I was able for another session, I was able to educate a client and I was able to take their vitals. I was able to ask them about their occupational profile. So questions that OTs always ask before they get discharged home. So I learned a lot on that field work, and I'm loving my pediatric fieldwork rotation right now as well. I'm learning so much and also seeing things that I'm learning in the class. So back to the classroom as a clinic and a clinic as a classroom, just learning so much from them.
Great. Thank you both very much. And again, apologies, but there's something wrong with my computer. So we love telling you about all the wonderful things about MCPHS and our program, but really it comes down to the outcomes. The occupational therapy program has a strong record of our outcomes. As you can see, we're building a legacy of strong graduation rates, board pass rates, and again, and I mentioned in the beginning, students are really finding a job after graduation, or if they're at a field work site and there's opportunities available there, they're being offered jobs. If you decide to attend MCPHS, and we hope you do, you can expect a high quality education that prepares you for both the boards and your professional life post-graduation. Professor Dallin, do you want to talk about some of where our graduates are working after graduation?
Absolutely. Some of my students during fieldwork have already told me they are very excited to stay at their placements to work. But after graduation, many students typically work in inpatient or outpatient hospitals or clinic settings. Some choose to work in school systems, home health, even community-based programs. And there's a lot of that being developed, especially with the mental health programming. As the field of OT continues to grow and OTs find themselves getting involved in many different non-traditional areas of practice, such as driving rehabilitation, ergonomics, home and community, outdoor hippotherapy, and development of robotics.
Thank you. So now we've kind of told you about the program and hearing about all the wonderful things, the application requirements. Some of you probably already started your OTCAS application. Some of you might be just gathering all of your information before you do so. So I would suggest to apply early. It is rolling admissions, which means once you've submitted your application and all of your admission materials through OTCAS, then we will review it and make an admission decision, which we're already doing with some of our applications already. One thing is important to note is that you can only apply to one campus. So either the Worcester or Manchester, you cannot apply to both. When you're going into OTCAS, and I'm happy if anyone doesn't have that link or information, I'm happy to send that to you in an email afterwards. You will go into the OTCAS system and you will submit your application and all of your documents, which includes your resume, a personal statement. Now that personal statement is really talking about what you know in OT field, what your personal experience is, why you want to go into the OT field, what your commitment is to that. And that's really what we're looking for, and obviously well written. Your official transcripts, and this includes one of the things that is a little bit time consuming is entering in your prerequisites that match up with our prerequisite requirements. You can pay OTCAS to do that for you. I find if you just set out a block of time and match up your courses with our prerequisites, it's a little labor intensive, but it's really not that bad. 3 letters of recommendations, and this really needs to be a professional or education. So from a professor, or if you're currently in a field, or if you've been working as a rehab aide or whatever, looking at those 3 letters of recommendations. And then volunteering and shadowing experience. These are not required, but strongly encouraged. It is good to kind of, I think it's important just from a personal level that you want to shadow and see if this is definitely something that you want to commit to. So it's really important. We do look at a 3.0. If you have a little bit below that, but have a lot of experience, OT experience, and you've been in the field and have wonderful recommendations, we will look at that. OTCAS will verify all of your information, and once that's complete, they'll then send it to us. It takes a couple weeks for them to verify your transcripts and your evaluations, but then once we have everything, we will look at that. And then we're sending out our admission decisions probably 3 to 4 weeks. It's a busy time of year right now, so be patient with us. There is no interview required, which is different from some programs. So prerequisites. This is always fun. We do have a number of prerequisites that you do need to have completed by August 1st. With that said, we will give an admission decision if you are missing up to 3 prerequisites, as long as you're not missing both anatomy and physiology 1 and 2. But you can be missing up to 3, as long as we know you have a plan in place, you're in progress, and they're all completed again by August 1. So we, again, for prerequisites, require anatomy and physiology 1 and 2 with your lab. We'd like to see your abnormal psych class, a child, adult, or lifespan development course, and 3 social science electives. I do want to point out with social science electives that that does not include an educational health class, science class. It needs to be history. It needs to be an economics, a women's studies, anthropology, anything like that. No science kind of related class. And then the final class we require is statistics. So for financial aid, we do offer financial aid through FAFSA. We also have a merit scholarship for up to $8,000 a year. You're automatically considered for it. You don't have to apply, and there's no additional application for the scholarship. You're just automatically considered. If you are looking for financial aid, I suggest, and I can put you in touch with our student financial services to kind of figure out what that plan is for you. A lot of students wait until they've received an admission decision and then start that process and what their kind of financial picture will look like from there. Finally, as you go through the process, I'm your contact for both the Worcester and Manchester campus for the OT program. I am happy to walk you through the process if you have questions, point you in the right direction for whatever you have. I suggest taking a screenshot so you have that information. Check out our admissions YouTube channels. And if you haven't toured our campus, for our Manchester, if you're interested in the Manchester campus, this Thursday evening, we are having a fall reception at 5 p.m. If you're interested in attending, please let me know. I can send you the registration link. For those for Worcester, it's next Thursday, the 14th, and that starts at 4:30. I would highly suggest you attending one of these events. It's a wonderful opportunity for you to see the campus, see our labs, meet faculty. You'll have a student panel. So this is a really wonderful way for you to kind of immerse yourself and learn more about the program. If you can't attend, that's okay. We offer tours throughout the year and probably we'll be doing a spring one as well. Okay. So questions. Maura, why did you choose MCPHS?
I chose MCPHS for a little bit of a different reason than my fellow classmates. So I was a pathway student. It's 3 years of undergrad and 2 years of grad school. So I'm done in 5 years compared to others where it's for them it's 6 years, or even other people it's going to be 7 years if they didn't do MCPHS. Um, just and also what the school has to offer, like what we went over earlier, there was the faculty mentor, peer mentors, counseling services, stuff that is offered to us, and even the curriculum, how mental health is woven in. I love learning about mental health and I want to incorporate that in my practice somehow. So just having honestly every class throughout my time here, somehow bringing in mental health into it is just something that I loved, and just how close you get with the people in your class and how helpful the professors are as well. One thing that I didn't mention earlier is that the professors have an open door policy. So if their door is open and if you have any questions, just go in. I do it all the time. I did it a bunch today because I had questions on an assignment. And for the most part, they all have candy, which is another good thing. So we get fed well here. And if they're not available, they're more than happy to set up a time either on Zoom, on campus to meet with you, which is really nice.
All right, thank you. One of the biggest questions I think we get asked is, and I'm going to throw this to Professor Dowling, is the difference between a master's and a doctorate of OT.
That's a great question. There's several kind of points of entry into occupational therapy. There's the certified OT assistant, there's the MSOT, master's, and there is a doctorate. There is no mandated entry and degree format at this point in time. Coming forth from our accrediting body, I am on the representative assembly for AOTA, and there is nothing coming down the line that is mandated. What we keep an eye on is how are other allied health professionals doing when they move towards a doctoral degree, and what are the return of investments for that extra education, and how does that impact the clinical landscape? And OT has found that the master's level is doing a wonderful job at meeting population needs, population health needs, and as well as building the landscape of occupational therapy. So right now, being a practitioner as a master's entry is perfectly wonderful. You will receive all the necessary information you will need to pass your boards and be a great clinician. You can always go back to school and get your doctorate. And should the accrediting bodies choose to make a doctorate as the next necessary thing, you'll be grandfathered in with your master's degree. But the biggest concern I want to relieve for you is that you are going to be exceptionally trained by this institution to care for people in occupational therapy with a master's.
Great. Does anyone have any questions for us? No. Oh, we have one. Oh. Ashley, did you have a question for us?
No, I didn't.
Oh, okay. Sorry. I saw your hand raised.
No, sorry,
I just wanted to make sure.
No, it's okay. I'm sorry. I think I might have pressed that by accident.
Okay. I didn't mean to call you out, but gold
No
star for letting
problem.
us to ask you.
No problem. Thank you.
She
Thank
was
you.
giving us a high five.
She was saying great job, even though
Yes.
you had technology issues. Fidel, how are you?
Hi, Tina. How are you?
Good.
I actually had a question for Maura.
Yeah.
Maura, what would you say is the hardest part of adjusting to like OT school, like just coming right into it after your bachelor's, like the hardest kind of aspect for you personally?
Yeah, honestly, this is gonna sound so lame, but my biggest adjustment was not having my friend group that I had in undergrad, because I've known a lot of them for years. I knew one of them since I was in kindergarten, so I had her for a huge chunk of my education. So just adjusting without them. I was also in Boston, so I was living on my own. I moved back home. I'm commuting. So adjusting back to that was really hard, and balancing like knowing when to give myself grace and to do things that I want to do, like put the books down and go out and do something that I want to do that's going to help me in my mental health. It took me a while. I'm still learning, but I've gotten a lot better just knowing when to give myself a break. Like go for a walk, go to the gym, hang out with my friends, hang out with my family, just do something that I want to do. If there's something that you really want to do that presents, do it. I think your mental health should come first. And I mean, granted, if there is an assignment due that night that you need to do that first and then do what you have to do, but do things that you enjoy doing that make you happy as well.
Great question, great answer. Thank you so much. Does anyone else have any questions about either the occupational therapy field or the program? Professor Dowling is an expert here, so we use her wisdom. If you don't, and you'd prefer not to do it on this information session, that is okay. You happy to email me with any questions regarding the admission process or specifically from Professor Dowling, and I can send that off to her, or even to Maura. We'd be happy to send those questions off to her, specifically if you have any student-related questions. We hope to see you at one of the upcoming fall receptions. That's, again, a wonderful opportunity. And if not, a campus tour, scheduling that for either campus is a wonderful way to kind of get to see where you could be spending home for the next 24 months. And as you go through the OTCAS process, again, please feel free to reach out with any, more questions. I think Phil has one more question.
I'm
Okay.
sorry, Tina. I just had a press.
That's
I'm
okay.
sorry. I had a question for Professor Dowling.
Yes.
So she teaches research methods, right?
Evidence-based practice, yes.
Evidence-based practice. Oh, okay. I just had a question. What course do you think that you taught is like the most challenging, like for first year students, that like before you kind of apply, you kind of have like a basic knowledge just before that course, just to stay ahead of the game, in your experience?
For my students to stay ahead of the game, and what course might be more difficult for them?
Yeah.
I would say as soon as someone hears evidence-based practice, the little hairs on their neck just start to stand up and they twitch a little bit when they think about their statistics. And I think that course, the one I teach, is the one that they just kind of hold themselves at an arm's length away from, but it's a flipped classroom. So what that means is I do all my lectures on video, and there's a workbook. So you listen to my lectures and you work through the workbook, and then we do team assignments. So you don't have homework per se, you're kind of learning the information at your pace. My videos are out there. Then when you come into the classroom, we do team-based learning. It's a team that you'll be on for that class and your group's class, and those two classes thread together. I think we make it fun. I think science shows that a flipped classroom is an excellent way of learning because you're learning it at your pace, then you're coming in and you're kind of learning stuff again. I would say, unfortunately, my class might be the one that people are most concerned about, but I do think Dr. Robertson and I, she's in the Manchester campus, I think we do a pretty good job at making it tolerable. What do you think, Maura?
I totally agree. I enjoyed the flipped learning a lot. And also you're working with a group of people and you have your classmates too. So if you have any questions or if you're struggling, I know one professor here does 3 before me. So we take advantage of that here. So we go to our classmates first, we look it up because that's what you're going to be doing in the real world as well once you get a job as an OT. So I think I was very scared of EBP, evidence-based practice, when I was first coming in, but when I started, I was like, oh, this is going to be fine. Like, I'm going to be totally okay.
Thank you, Maura, Professor Dowling. Adele, thank you.
Mhm.
You had a lot of great questions last week too. If no one has any other questions, I appreciate everyone's time. I apologize again for my technical difficulties, but I hope you benefited from hearing from Professor Dowling and Maura and a little bit more about the program and the admission process. And please feel free to reach out to me with any other questions. So have a wonderful evening, and hopefully we'll see you at an upcoming fall reception this week or next week. Thank you all. Take care.